Welcome back to the show Talk with Your Doc. I am Dr. Prashant Tijani, and with us is today Dr. Marlon Hagerty, and we are talking about role of radiation in prostate cancer. Thank you, Dr. Hagerty, again. And you were mentioning before the break that radiation is given to patients depending upon the aggressiveness of the tumor, the stage of the tumor. Now, please tell us how does one select whether he wants to go for radiation or surgery?
Well, if both are an option, then we just leave it to the patient to decide. And ultimately, the patient always has the final decision to make. What I try to do is basically help to interpret what the patient's cards might show, and they make their own play based on how they feel personally and what their goals of treatment are. So as far as surgery goes, usually that's for younger men to take that route. Or if it's very aggressive prostate cancer, sometimes the chance of surgery being effective to actually get a cure would be lower. Mm-hmm. The surgery wouldn't be able to take everything out.
Yes.
And so sometimes when I meet with the surgeons, we just say, well, we'd really just recommend the radiation.
Right.
So we would always try to make a recommendation if one was clearly better, but sometimes it's just really up to the patient.
Because surgery itself has a lot of complications, so radiation should be the first choice, or surgery should be the first choice. Many patients have this confusion. Mm-hmm. So it depends upon the age, as you said, and then the stage of the tumor.
Mm-hmm. Yeah.
So younger the patient, they prefer radiation, or they should prefer surgery?
It always comes down to a personal decision, because the side effects of surgery and radiation are quite different. And so any given patient might think that they would prefer the potential side effects of radiation versus surgery, or the other way around.
Okay. Now, once somebody decides to take a radiation therapy, how long is the whole treatment course? How many months or weeks one has to go through the radiation treatment?
So usually patients now are going through 4 weeks of radiation. So that's 20 treatments, Monday to Friday, no weekends, no holidays. Yeah, so they come into the cancer center for about 45 minutes a day. Mm-hmm. The actual treatment itself would be more like 5 minutes. It takes a lot of time just to get them lined up to be in the perfect position, because of course the radiation treatments are all based on your anatomy, and it's all calculated down to the millimeter. So we have to be very exact when we give the treatments. So there's a lot of effort to get them exactly in the right place. Once the beam is on, though, it doesn't take very long for the treatment to be delivered that day.
Now, is this the same time frame for both external beam and the brachytherapy, or it's different?
No, for the external beam, it would be several minutes, like I'm saying. For the brachytherapy, that's done under anesthesia, so there's all of the time of anesthesia and the putting in the needles, that sort of thing. So that would be a procedure that would take more like 2 hours to do.
And is that one sitting only, or they have to come for multiple sittings?
Again, depends on the scenario. If it's LDR, the low dose rate brachytherapy, which is what we use more for less aggressive prostate cancers, it would be a single procedure. Mm-hmm. If it's the HDR brachytherapy for more aggressive cancers, it would be usually a single procedure that's done, and then several weeks after that, they would follow up with external beam radiation. Now, what we're actually looking at right now with research is to see if we can give the HDR brachytherapy all on its own without any external radiation. And there certainly have been some patients that have had that treatment under the context of clinical trials, but we're not really ready to roll that out with all patients, and we'll have to see what the research shows about that.
So now, external beam radiation versus brachytherapy, what are the side effects of each of this?
So for the brachytherapy, you would think more of the side effects of anesthesia, and also since needles are going through the skin, there's a chance of infection, bleeding, inflammation. Like I was mentioning before, sometimes there can be enough inflammation where the urine can't pass through and out, and so that patient might need a Foley catheter to be placed for a while until they can pee again on their own. And then there's potential damage to the urethra with scarring and damage of the bladder and the rectum behind the prostate. That's for brachytherapy.
So all these patients, everybody who gets this brachytherapy, they have these side effects? Or
No,
some gets
no.
and some doesn't get?
These are theoretical.
Theoretical. Not everybody gets those.
Absolutely. We often have a delivery of brachytherapy that is very safe. Patients walk in, walk out, they're feeling pretty good.
So usually there are no
bleeding.
side effects.
Well, I guess it all depends on, what we do is we divide up side effects in the grades.
Yes.
So higher grade side effects, which are more symptomatic or life-threatening, that kind of thing, that would be a rare occurrence.
Yes.
Minor side effects like irritation of the bladder and the bowel, burning when you pee, that sort of thing, that would be more common.
And they go away after some time after the therapy, or how long they stay with you?
Yeah, usually those side effects will improve after several weeks of treatment.
Okay.
And there is the potential for long-term side effects as well. And that's what I always am very careful about. One thing when you're getting external beam radiation therapy is to regulate the bowel movements and have the bladder nice and full every day for radiation, because if you think of your bladder collapsed down right near the prostate, then if you're treating with radiation onto the prostate and focusing the radiation there, if the bladder is collapsed down, then a lot of bladder gets a high dose of radiation too.
Yeah.
So if you drink a lot of fluids before and fill the bladder up and get it out of the way, then the chance of long-term side effects to the bladder is a lot lower.
Right. Now, do the patient have who receives the brachytherapy, they do have an impact on their fertility or childbirth?
Yeah, for sure. Oftentimes we treat not only the prostate itself, but the seminal vesicles as well. And both of those they're sexual organs for a man.
Right.
And so if a man is treated with radiotherapy for the prostate cancer, we would definitely treat the whole prostate gland. And sometimes we extend up into the seminal vesicles too, depending on how aggressive the prostate cancer is. And that's simply because the cancer can grow up into there too, and we want to kill all the cancer cells. So after the treatment is done, then the ejaculate would be much less volume, because the fluids that are made in these glands aren't made anymore. And that can affect fertility. So even though a man might still be able to make viable sperm, the delivery of that can be affected.
So it can affect the fertility.
Yeah.
And does the same side effects are with the external beam radiation, or these are specific to brachytherapy?
It would affect both.
Both have similar side effects then, probably.
Well, as far as the fertility, I would say yes. Yeah.
Okay. Now, is there any treatment options for the side effects?
Definitely, and I should add, for fertility reasons as well, there are nerves that come down the bottom and the sides of the prostate gland that are used for erections. And over time, after radiation, those nerves can be damaged. They can slowly accumulate the effects of the radiation, where they aren't able to function as well and pass the signal through the nerve. And if that's the case, then somebody could develop erection problems. So that can, of course, affect fertility. And as far as the side effects of treatment, I'll often help a patient with erectile problems after radiation if they needed it. And that could be simply with we have sex therapy or sexual education classes that we offer to cancer patients at the Cancer Center, and also medications to help with erectile dysfunction. And then if that's not effective, then we could send them to a urologist and to do other things such as injections directly into the penis to cause an erection.
Thank you, Dr. Hagerty. We'll take a short break and we'll come back. Thank you. Please stay back for the last part.